Hi everyone, welcome back to my YouTube channel. Today we are going to talk about neonatal skull, and here at the side you can see the diagrammatic representation of neonatal skull, the lateral view and the superior view of it. So let's start the topic with introduction. Neonatal skull is markedly different from that of an adult skull. It is relatively large compared to the body, soft in places and still undergoing ossification. These characteristics allow for flexibility during childhood and postnatal brain growth. We will talk about general characteristics. It is proportionally large, that means the head makes up about one fourth of neonate body length, compared to the adult that is one eighth of the body length. Second is incomplete ossification. Many skull bones are still developing, with some separated by membranous gap that is called fontanelles. Next is flexible and expandable bones. As they allow passage through the birth canal and accommodates rapid brain growth, they are flexible and expandable. Next, we will talk about fontanelles. Fontanelles are fibrous membrane where sutures intersect. They allow the skull to mold during birth and expand afterward. First, we have its anterior fontanelle, then we have its posterior fontanelle. Third fontanelle is anterior lateral fontanelle, that is also called as sphenoidal fontanelle, and posterior lateral fontanelle, that is also called as mastoid fontanelle. All of these you can see here in the diagram, especially in the lateral view. All four fontanelles are visible. We will talk about these fontanelles one by one. First, we will talk about anterior fontanelle. You can see here in the diagram. In both diagram, it is visible. It is diamond shaped when you see from superior view. It is located at the junction of coronal and sagittal sutures. It is closed by 18 to 24 months. Second is posterior fontanelle, as you can see here in the diagram. It is triangular shaped when viewed from the superior view. It is a junction of sagittal and lambdoid suture. It closes by 2 to 3 months of age. Next fontanelle is anterolateral fontanelle or sphenoidal fontanelle, as you can see here in the diagram, especially in the upper diagram. It is present on either side at the junction of frontal bone, parietal bone, temporal bone and sphenoid bone. It closes by 6 months of age. Next is posterior lateral fontanelle, that is also called as mastoid fontanelle. See that in diagram. It is junction of parietal, occipital and temporal bone. It closes by 6 to 18 months of age. Now let's talk about skull bone and sutures. Frontal bone. It is divided into two halves separated by metopic suture that usually fuse by age 6. Next, skull bone and sutures of neonatal skull we have is parietal and occipital bone, that is large with thin cortical layers. Next, mandible, that is initially consists of two halves connected by mandibular symphysis that fuses by 1 to 2 years of age. Next, we will talk about sutures of neonatal skull, that are fibers joined between the bones that remain open during infancy to allow skull expansion. Now let's talk about molding of bone in neonatal skull. During vaginal delivery, bones of skull may overlap slightly at the suture, especially at the anterior fontanelles, to allow easier passage through the birth canal. This molding usually resolves within the first few days of life. Next, let's talk about clinical significance of neonatal skull. First is bulging or sunken fontanelles may be there. The bulging may suggest increased intracranial pressure, and sunken fontanelles may indicate dehydration, and that's the reason it is important to see for fontanelles area. Next is delayed closure. It may occur with conditions like hypothyroidism or hydrocephalus. There is delayed closure of the sutures, and the bone ossification is also slow. Next, there may be premature closure, that is also called as craniosynostosis, that is early suture fusion that can deform the skull and limit brain growth. Next is palpation of fontanelles, as is a non-invasive way to assess neurological status, hydration and skull growth. Now let's talk about conclusion of this lecture video. Neonatal skull is marvel of biological engineering, lightweight, pliable and responsive to demand of birth and development. Its soft spot are not weakness but windows into the dynamic changes happening in the infant brain and body. And this was all about neonatal skull. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.